Hello everyone, welcome back to my channel. I'm going to read now the next section in the nursing assistant care, the basics. I have some time to read some of it. So I'm going to read describing barriers to communication. Communication can be blocked or disrupted in many ways. These are some barriers and ways for a nursing assistant to avoid them. Patients do not hear the NA, does not understand the NA should face the resident. He should speak slowly and clearly. He should not shout, whisper, or mumble. The NA should speak in a low voice using a pleasant tone. If the resident was wearing a hearing aid, the NA should check that it's on and is working. The resident's difficult to understand. The NA should be patient and take time to listen. He can ask the resident to repeat to explain the message. He should then state the message in his own words and make sure that he understood. The NA residents use other words that are not understood. The NA should not use medical terms with residents or their families. He should speak in simple, everyday words that ask what means if he's not sure. NA NA using slang or profanity. The NA should avoid using slang words. They are unprofessional and may not be understood. He should not use profanity even if the resident does. The NA uses glitches, are phrases that are used over and over again, not really mean anything. For example, everything will be fine is a glitch. Instead of using the glitch, the NA should listen to what a resident is really saying. He should respond with a meaningful message. NA responds with why. The NA should avoid asking why. When a resident makes a statement, why questions make people feel defensive. NA gives advice. The NA should not offer his opinion or give advice. Giving medical advice is not within the NA scope of practice. It is considered dangerous. The NA asks questions that only require yes or no answers. The NA should ask open-ended questions that need more than yes or no answer. Yes or no answers end conversations. For example, if the NA wants to know what a resident likes or eats, he should not ask, do you like vegetables? Instead, he should ask, which vegetables do you like the best? Patients speak in a different language. If a patient speaks in different language than NA does, the NA should speak slowly and clearly. He should keep his messages short and simple. He should keep his message short and simple. He should be alert for words the resident understands. The signs of the patient is pretending to understand. He may not use communication board. If the resident prefers to communicate in her native language, an interpreter or interpretation services should be used. The NA should be patient and calm. NA or residents uses nonverbal communication. Nonverbal communication can change a message that he should not be aware for his own body language or gestures. He should not look for nonverbal messages from residents and clarify them. For example, Mr. Feldman, you say you're feeling fine, but you seem to be in pain. Can I help? Defense mechanisms may be considered barriers of communication. Defense mechanisms are unusual behaviors used to cope with stress. They block uncomfortable, threatening feelings. They are some common defense mechanisms: denial, completely rejecting the thought or feeling of not feeling upset with you; projection, seeing feelings in others that are not really seen one's own. My teacher hates me; displacement, transferring strong negative feelings to a safer situation. For example, our unhappy employee cannot yell at his boss for losing his job. He then later yells at the rationalization, making excuses to justify a situation. For example, after stealing something, saying everybody does it. Repression, blocking painful thoughts of feelings from a mind. For example, having no memory of a disturbing event. Regression, going back to an old, unusual, immature behavior. For example, throwing a temper tantrum to it as an adult. Culture can affect communication. A culture is a system of learned beliefs and behaviors that is practiced by a group of people. Each culture may have different behaviors, knowledge, beliefs, value systems, religions of customs. When an NA communicates with a resident, she should ask herself these questions. What information do I need to communicate with this person? Does this person speak English at first, a second language? Do I speak a person's language, or do I need an interpreter? Does this person have any cultural practice about touch gestures to adapt to? Is it important for NA to be sensitive to each resident's needs? This is a key. Providing professional person-centered care. Learning each resident's behavior and preference can be a challenge. However, it's important to communication is especially vital for multicultural society made up of many cultures, such as the United States. Listening, observing carefully will help NA better understand residents' needs and feelings. Okay, everyone, that will be the end of this section. Have a good one. Bye bye now.